All right, guidance from the American Academy of Pediatrics recommending that all children over the age of 2 wear masks when they go back to school, even if they're vaccinated.
Now, that suggestion comes despite CDC advice that vaccinated students do not need to wear masks. UW Health's Chief Quality Officer, Dr. Jeff Potoff, is back with us for his weekly visit. Good timing. Good to see you, Dr. Potoff.
Good to see both of you.
So this is conflicting guidance for parents. What is your advice for parents?
I can see how this would be confusing. So the CDC, with the guidance that vaccinated children are at very low risk of severe disease and they can go without masks, that's true. I think what the American Academy of Pediatrics is trying to do is they're saying, wait a minute, that's true, but how do you know who's vaccinated in school? And how do you know that those kids that are eligible for vaccine actually got it? A lot of those kids can't get vaccinated. Just keep things easy, mask those kids until everyone has a chance to get vaccinated.
So is this going to be up to individual school boards to decide this?
Well, I think so. I think that's how it's playing out. And there's other factors, you know, how are the cases doing in your local area? What's the impact of Delta? But for the most part, there are not going to be many places in the U.S. where especially those K through 6, those unvaccinated kids should be going back to school without a mask.
Where are we in terms of a vaccine for kids under 12?
The latest we've heard is there's a chance that Pfizer might have something ready for emergency youth authorization in September. You know, that got pushed back a little bit because we weren't having many cases of COVID in the country. Now with Delta and more cases, you know, if there is a silver lining, it means we're likely to have data on that vaccine for kids on time again.
Let's talk about Delta. Almost all of the new unvaccinated cases are Delta, aren't they?
Yeah, I mean, Delta is the real deal. It really is becoming the dominant strain, and that's a problem because it's way more contagious. Folks that got away with things last year, maybe they're unvaccinated, probably not going to get away with it this year. It's way more contagious.
Is this a little COVID deja vu, or is this a wave that will pass? I mean, are we headed in a dangerous direction?
You know, I think we could continue to see more cases. That's the bad news. The good news is if we look at the people who are vaccinated, it is the elderly vaccinated at high rates. It is those who have comorbid conditions that would have filled up our hospitals, that would have had a greater chance of severe disease. So it's not to say that we aren't going to see severe disease. We will. It'll probably be in folks who are younger, but probably not to the same volume that was overrunning our healthcare system last fall.
And if you're vaccinated, there's been a few reports of breakthrough cases where people that are vaccinated get COVID, but you're not getting sick.
Right, and you're going to see this because the vaccine performance against Delta, although very, very good, you do see more cases of mild or asymptomatic disease in folks that come in contact with Delta. So you'll see breakthrough cases. Those folks will almost always never be in the hospital. They'll almost never die of COVID, but they might have some mild symptoms.
We mentioned that cases are rising in all 50 states. How are hospitalizations here locally?
You know, right now they're holding steady. We had a little slight increase, but not much. Our baseline there was low, but you know, Dane County is a bit of an anomaly. Vaccination rates here are very, very high, and that affords those of us in Dane County a fair bit of protection.
But we're probably not going to get to where we were last summer or last fall with the Delta.
Yeah, I think that's unlikely. You know, even in states that have poor vaccination, they are having better vaccination amongst those highest risk groups. So that should help us stem a big problem like we had last fall with hospitals nearly collapsing.
You would think if you weren't vaccinated and you hear all this news, you'd think, okay, it's time.
You know, I may be biased, but I've come to that conclusion a long time ago. The upside of vaccination is tremendous. The downside is really pretty risky. I don't think I'd want to take my chances.
And there've been interviews with people in the hospital now, and they're saying, I should have gotten the vaccine.
Yeah, you know, and that's, you know, one of the things that I said early on in the pandemic is the number of people that I saw that said, you know what, I didn't think it was going to be me. I thought I could beat this. And now they're frustrated. They wish they could have a do-over, but unfortunately they don't. Now they see what happens. And that would be a great thing for folks to think about or talk to those people who you know who've been in the hospital and say, hey, what do you think about the vaccine? Most of those folks are going to say, man, I wish I had that chance.
Yeah, absolutely. All right.
Great to see you, Dr. Potoff. Thanks for your time.
We'll see you next week.
You bet.
All right, we'll be right back with the final check of your forecast.